India's COVID-19 surge is believed to be driven by a new Omicron subvariant known as Arcturus. The country has reported more than 11,000 new infections in just the last 24 hours. Studies say Arcturus is more transmissible than previous strains of COVID-19, but is not thought to be any more deadly than other Omicron subvariants. India has begun mock drills at hospitals to assess if they are prepared to deal with rising case counts. Some states have also reintroduced mask wearing in public places and schools. And Ershan Garg joins us live from New Delhi. Ershan, we heard that numbers going up in India. How serious is that, first of all? And apart from measures like reintroducing mask wearing, what else are authorities doing to deal with this surge in infections?
Well, the situation seems very serious in the sense that the cases have been rising very, very quickly. So in the past 3 days, we have seen almost a threefold increase in the daily COVID-19 cases being reported. But in terms of seriousness of those cases, the situation is rather fine right now. The hospitalization rates are not up, and therefore the government is saying that there is no need to panic. But at the same time, they are making sure that they are preparing for a potential surge in infections, which many experts say could be likely given that India has lifted most restrictions, but some of those restrictions are coming back, as you pointed out. Apart from that, the government is also making sure that it's increasing testing across the country. The country's health minister has said that most states in India are testing way below the national average, so those states need to ramp up their testing. At the same time, the vaccination, that has kind of fallen off the track. In the past few days, we have seen that at least a dozen states haven't administered a single dose of the vaccine. Now, more than 95% of India's adults have at least received one shot of a COVID-19 vaccine, but experts say that that might not be enough as COVID-19 variants are now mutating. So the government is saying that it's going to put a renewed focus on ramping up vaccination of the second dose as well of the booster shots for those who are especially vulnerable to the virus.
Arshad, if you look at the situation in India, does that explain why the World Health Organization is calling this latest subvariant Arcturus, quote, the one to watch?
Absolutely. There are certain very key properties in this virus that make it the one to watch out for. A recent study from the University of Tokyo has said that this virus could possibly be nearly 1.2 times more transmissible than the previously most transmissible virus of coronavirus subtype, the one that was nicknamed Kraken. So there is the issue of increased transmissibility. There is the issue of increased pathogenicity, which means that this virus could be affecting more people and could be causing more infections in children as well. Now, as far as the scientists in India, as their research goes, they are saying that they have not seen if this virus is showing immune escape properties, but that could be proved wrong as the research continues in the days ahead. So it does look like this virus could create several problems, and a sign that how transmissible it is can be seen in India. In just the past 2 months, now it's accounting for nearly 1/3 of all COVID-19 infections, whereas just 2 or 3 months ago, that number was down to about 10%. So it's certainly one virus that authorities have to keep a track of. And as most of the world has started reopening and the boundaries have become open to travelers, this new virus means that it could spread outside of India, potentially to other countries as well.
Well, thanks to Ershan Garg there laying out the coronavirus situation in India for us live from New Delhi.